never forget what we fought for 100 years with blood, sweat, broken bones.
This is Steve Zeltzer with Workweek, and we have covered the situation, the health and safety situation of the residents of East Palestine, Ohio, what happened when there was a rail derailment last February at that town, and the potential and likely health ramifications for the residents and workers. And joining us is Dr. Golom, who is a medical professional at University of California, San Diego, who's been studying some of the effects and raising issues of concern about the chemicals, the dioxins, and the chemicals that were used that happened to explode and were exploded at that incident. So welcome to our show, Dr. Golom.
Pleasure to be here.
So Dr. Golom, what brought you to do this investigation of the possible medical dangers, health dangers at that incident?
Like many others, we were exposed initially to the occurrence through the news media and concerned because of our past work on people with chronic health problems following mixed toxic exposures, incidents like the Persian Gulf War with Gulf War illness, and also other events like the World Trade Center. We're concerned about the possibility of long-term health effects. And a month or so in, we perceived that perhaps not enough attention was being paid to this possibility. So we began to make contact with people in East Palestine and initiated the early phase of a health study that we now have ongoing.
Maybe you can talk about the chemicals that were released, the vinyl chloride and the combination of these chemicals, and what potential dangers there are to those people who have been contaminated by these chemicals.
So there were a large number of different agents released. Vinyl chloride was prominent among them. Vinyl chloride has been listed as a potential terrorist threat, and when burned, it produces phosgene, which was used as a chemical warfare agent in World War I. And 3 days after the February 3rd, 2023 derailment, there was a decision to, quote, vent and burn the toxins that led to release of phosgene plus many other chemicals that are produced during such incineration events. There were also agents like dioxins, referred to as forever chemicals, and furans and butyl acrylate. A good number of others. It was a car with electric vehicles, and that produces, heavy metals plus the combustion products of the plastics, around the wiring and the fuels and so forth. So a very large number of different agents. And I think there are many who just presume that if levels of individual agents are within safe limits, which in this case they may or may not have been, that there are no health problems. But in fact, it is both the case that many chemicals will actually impede or compete for detoxification processes with other chemicals, making each of them more higher level in the body, but also there are critical shared pathways of toxicity that transcend the nature of the specific chemical and that we showed were the basis for the chronic health problems in Gulf War illness. These include damage to the so-called mitochondria, the powerhouses of cells, and essentially every one of the East Palestine chemicals are also known to produce mitochondrial toxicity. So this mechanism is expected to add across agents, add and synergize, and can readily surpass toxic thresholds in complex chemical mixtures, even when levels of individual toxic agents are within normal limits. So that was a major source of our concern, and many of the sort of more persistent problems that people were reporting in East Palestine are a fit to the problems that we anticipate with that type of injury, a fit to what was seen, for instance, with Gulf War veterans.
And what are some of those problems that people have had, health problems at the site?
So there are sort of the symptoms that, as I say, are also seen with Gulf War illness, and then there are also health conditions that are emerging that were also reported to be elevated in Gulf War veterans. Some of the symptoms include fatigue and problems with sleep, pain problems, neurological, cognitive, and mood problems. Again, very prominent in this group. Gastrointestinal problems, diarrhea was the signature gastrointestinal problem in Gulf War veterans, although gastroesophageal reflux or acid reflux was also very common. We're seeing the same here. respiratory problems, including shortness of breath, sinus problems, also very common in both groups, and also a range of different dermatological problems, rashes and hair loss, etc. There are also some highly unusual problems that were distinctive in the Gulf War, like veterans would report at many of the meetings in the public comment section that their teeth were falling apart and falling out. It was not a phenomenon that was true for most veterans, but it was true for a minority, and it was a very distinctive phenomenon. We're hearing similar reports here. And then also there are clusters of individuals sharing on Facebook problems that are known to be increased in Gulf War veterans that range from seizures to a number of people reporting having to have their gallbladder removed, heart disease, hypertension, chronic fatigue, chemical sensitivity. These are all among the problems that data show are elevated in Gulf War veterans and that are being reported. We don't know yet that they're elevated here because that character of data isn't yet available, but we certainly know that people are reporting that they are experiencing these problems, and there seem to be clusters of these problems.
And what have you done to get people there, the people of the East Palestine, to provide this information? It's very difficult. And has the government done any surveys?
There were a couple of early surveys by the Ohio Department of Public Health. There was also an early community survey that captured early symptoms, which were many of those were irritant-related symptoms: burning eyes, burning throat, burning nose, burning lips, burning mouth, burning esophagus, vision problems, which are still being reported, et cetera. And then, sinus congestion appeared early, just as it appeared early in Gulf War veterans. But now the NIH, the National Institute of Environmental Health and Safety, has funded several studies. Some of them are looking just at the exposure side of things, and a couple of them are looking at different aspects of health. Ours is the one that is focused on tying these mixed toxic chemical exposure health effects to the ones that have been reported with previous mixed toxic exposures, and tying them to the objective laboratory test abnormalities that have been shown with Gulf War veterans. We think that this is very important because it means that work to help those in East Palestine to understand their health problems isn't really just important for them, and sadly it seems as though many people don't really care about them, feeling that they're sort of a small affected group that has potential ramifications for every past, current, and future mixed toxic exposure event. And toxic exposure events are very common. It's been reported that there are over 15,000 accidental, illegal, et cetera, releases of chemicals in the United States each year. Oftentimes, chemical exposures involve chemical mixtures, both because things like, a burn will inherently involve many different agents being aerosolized. Many types of events are in settings where there are chemical mixtures, factories, et cetera. And also, increasingly, because of all these toxic exposures, it will often be in a location where there are so-called legacy chemicals that are still resident in that area from previous exposures. So understanding the impact of mixed toxic exposures has implications that has a benefit potentially to us all, because any one of us at any time could be exposed to the next toxic exposure incident.
And when you talk about the numbers, I know that it seems like there's almost a weekly occurrence of explosions at refineries, chemical plants. It seems like there's an epidemic of these toxic releases all over the country. Is that the case?
Well, I can't really say. I mean, epidemic means more than expected, and there are a lot that occur anyway. But you're right; it is disturbing and concerning. And then we have events like the post-hurricane events where flooding may occur in former Superfund sites and lead to release exposure getting into the water systems of, again, resident legacy chemicals. So there are many different ways that mixed toxic exposure events occur, and the more we can understand them in order to develop protective and treatment measures to mitigate the health devastation that commonly follows these events, the better off we are.
And does it matter whether this site has been declared a Superfund site? I mean, there are many in Ohio, there are many chemical and radioactive sites. What do you think that the danger of that site was to the people and the community there?
I'm not really qualified to comment on, whether it, quote, matters, unquote, whether it's declared a Superfund site. I think certainly whether it's declared some kind of a disaster has implications for resources to the community, which are really important here because, this is a low socioeconomic on average community. Less than 10%, according to one of the residents, and I haven't actually investigated this, but somewhere on the order of 4 to 6% have college education. The median income, looking online, was in the order of $40,000 household income per year, and then they've suddenly been faced with tremendous costs for water, which has not been supplied by the government. Early on, there were, private groups that were doing the wonderful job of bringing in fresh water for people, but unfortunately, the evidence suggests that the contamination is still present. People report that after rains, when the water rises in the creeks, people become resickened, and people are being forced to pay their own money to try to, get water. Air filters for those who remain in the area. Many feel forced to move from the area because their health simply doesn't permit them. They report being resickened when they return to their home. They don't really have the financial resources. Some tell us that they don't want to sell their home because they feel it would be an injustice to anybody who bought it, but they don't have the resources to purchase another home. So many of them are in significant financial difficulties right now with that range of different factors. They'd like to get food that's ideally not locally grown because we really don't have we don't have any meaningful sense of whether it is safe to eat locally grown either produce or livestock. But again, the resources to do that are simply unavailable. I will also say that that we also would love, if people want to look at our website, golomresearchgroup.org, and anyone wants to consider donating, the costs of the testing that we're doing, well exceed the available supply, and we would love to just get donations to give people, to contribute to people getting incentives to participate, because that way the money could both go to help the study and also go directly to the residents affected by the derailment. So if anyone wishes to provide a donation, we would certainly be appreciative.
And how many residents have you tested in your surveys?
We have over 100 that have participated in one way or another. There are multiple different parts of our study. There's the survey component. They go to a local Quest facility for routine clinically relevant laboratory tests. We've also had several mobile phlebotomy events because there are tests that are not available through Quest laboratories that we think are important to do, where we have to pay for phlebotomists to travel. There aren't any very local to that area. There are some closer in Pennsylvania, but phlebotomists have to be certified within the state, and there are not local Ohio people. So that is, comparatively costly to do, but the results that we've gotten from those, which I unfortunately cannot share until we publish, are very interesting and looking very important. We also have kits that we sent to them for other tests that can be done and mailed into the respective laboratory from their home. We've sent people silicone wristbands for those that remain in the area that will capture chemicals for eventual, quote, non-targeted toxic testing, and that will allow us to look using a technology called mass spectroscopy at what are all the different chemicals that people are exposed to, because it has often been the case that the suspected chemicals are not necessarily the same as the chemicals that turn out to be important. There can be, again, like, for example, following, DDT releases over 50 years ago, people look and they say, oh, there's no DDT anymore. But then when they use this non-targeted technique, they find that there are a lot of persistent toxic daughter chemicals from DDT that are still present. So we think that this non-targeted testing is going to be very important. That's also pretty costly. So those are some of the elements for those participating. Each element is optional. People do receive a fairly token amount, $40 for participating in the both of the initial surveys for the study, in which people are asked to give a lot of information about exposures and health effects, and also the quote covariates factors like habits, smoking, alcohol, et cetera, that can be quote effect modifiers that can influence the impact of the chemicals on that health. So we are asking a lot of residents in terms of providing information so that we can do the best quality research, best understand who's vulnerable, who's protected, in order for the study also not just to provide answers and help to this group, but hopefully to lead to protections, post-exposure treatments that may help to mitigate the long-term health consequences.
And as far as government funding, it seems like either the government or the company should be required to do this kind of testing. Why is it basically a volunteer donation thing to do testing on people in this incident? Sounds like...
let me say that it's not fair to consider it just a volunteer thing. We do have funding from NIEHS. It just is it's called a time-sensitive award, which provides $200 and something thousand, which is actually, for a human health study, a comparatively small amount, and it simply doesn't cover all the tests that we're doing.
And just sending people to get tests and training and that kind of thing. I mean, it sounds like that's a big operation with thousands of people. How many people are you talking about that have been contaminated potentially? Is there any idea of that?
Well, I don't know the exact number, but the community of East Palestine per se is relatively small, under 5,000 people. But we're taking people up to 20 miles out, and I have not actually. I could probably have AI estimate the number of people in that larger radius. But there are certainly people into Pennsylvania and other areas, especially within the 10, but also within the 20-mile radius that also have experienced health effects that are aligned with the health effects seen in those closer in, and that also had other reasons for believing the health effects are tied to their exposure. So there's certainly thousands of people that were exposed. And potentially tens of thousands. Initially, the plume traveled quite a long way, including even up into Canada and over a good part of the southeastern United States. But the sort of longer-term exposure, of course, is going to be greater in those closer in.
And what happens to the residents, and I know some actually, that don't have the money to move away and are stuck in these houses that are contaminated with their children? What is the possible dangers and effects for them with these chemical toxins?
Well, many of those that are stuck there are sharing with us that they are experiencing significant health complications, and this is, a tragedy if you are the parent and are sickened and that compromises your ability, for example, to work. And some of the places that people worked, actually one of them, ones that were right by Ground Zero, also closed down, and people lost the health insurance that they had. And at least one of those people is now working in another place that's right by Ground Zero with very significant health consequences, but again, without the financial resources to move. It's just heartbreaking having people, I'm sick, I have sick children, I have trouble caring for them, I have trouble now having a job because of significant fatigue and weakness and GI problems and respiratory problems. And it's just heartbreaking, honestly.
And the other issue that is of some concern is the fact that workers who went there to investigate from the EPA, from the CDC, themselves got contaminated and sickened, and also the workers who are involved in the cleanup and the railway workers. Is there any investigation of these workers and how they're being affected, and the oversight of proper cleanup procedures in this toxic release?
I can't comment on the oversight of toxic cleanup procedures. That's really outside of my area of expertise. We are accepting into our study people that were exposed through their work as first responders or as cleanup workers. And we do have people who, including someone who, moved to a different state shortly after, but is still experiencing these chronic health effects, just as was seen with Gulf War veterans. Again, they were exposed during their time in the Persian Gulf in 1990 to 1991, and then they left that exposure environment, and here we are, 30 some odd years later, and the evidence is that those people are still affected, and that the problems that arise at elevated rates in those individuals, are continuing to occur. Some experience those early on, and some experience them later. But the data are that a range of different health problems arise at elevated rates in people who have had these mixed toxic chemical exposures.
And I have talked to residents. I saw a press release from the EPA saying that residents could go back to their homes. There wasn't a danger of vinyl chloride shortly after the release of the toxins. What is that all about? Because it seems that in line with your investigation that there have been serious contamination and people are in danger of their health of themselves and their children and families.
Well, I think, again, that there is a prevalent notion that if levels of individual chemicals that have happened to be tested in the particular time and place they were tested were with what are construed as safe limits, that people should be reassured. And I think people are concerned about stoking fear that might be unnecessary. But repeatedly, whether it was with the Gulf War where people were told everything was fine, or to the World Trade Center where people were told everything is fine, and now the evidence is that more people died as a consequence of being exposed to the air after the events than were exposed than died as a consequence of the original building collapse, et cetera. That there's just this notion that if you're not measuring something elevated, that individual chemical measurements suffice. And you've never tested every chemical. We don't have the ability to know what every chemical is. So perhaps this is a lesson that a more precautionary approach would be appropriate. I understand that there are economic ramifications that people would be concerned about. Even in East Palestine, people, there's also a business community there, and they don't want to deter people from going to the community to continue to have economic operations there. So, there are considerations on both sides, and I understand that those are legitimate. But the health considerations often are lifelong, and in some people truly devastating. And so I do think that this might be an opportunity for us to take this as yet another instance in which a mixed toxic exposure event may prove to lead to, again, we're only a bit over a year and a half out, but may prove to lead to significant long-term health consequences that may mean that a more precautionary approach might have been more appropriate.
And another issue has been, I believe that I've been told by residents that people are told not to talk about their illnesses. There's a pressure for denialism to say that it's not that bad. What does that do to the mental health of people and their stress when they have these symptoms and they're being told really keep quiet about them? And have you experienced any of that in your investigation?
Yeah, we've heard a lot of people talk about that, and they do report that there's bullying and that this has really torn the community apart. And again, it may be because there are legitimate economic interests on the other side, and people who are not themselves sick sometimes disbelieve people who are sick. Again, the same thing occurred in the Gulf War, where early on the claims were it's psychogenic, meaning all in your head, or it's compensation neurosis, or it's not really real, you're not ill at elevated rates, you're just imagining it. Pretty much with every toxic exposure that we have studied, we hear people being told those things, and sadly often even from medical professionals. And in the Gulf War, certainly the evidence absolutely conclusively has shown that yes, about a third of those that were deployed are sick attributable to their exposure, meaning they wouldn't have been sick. These are the fraction that are sick over and above the fraction that are sick in comparator groups. And actually that third is probably an underestimate because of the so-called healthy warrior effect. The people that are deployed are the ones that are selected for being healthier. The ones that have pre-existing health problems and are likely to do worse later are the ones that are selected for not being deployed. So even in spite of that healthy warrior effect, it's about a third that develop chronic health consequences as a result of their deployment, and data that are completely, cannot be questioned, including gene environment data, show that it is the chemical environmental exposure. People who have genetic impairments it's not necessarily even fair to say impairments, but who have genetic variants of detoxifying enzymes that are impaired at detoxifying a particular exposure, and then who also experience that exposure have radically higher rates of illness. And because people did not know their genetics at the time they reported their exposure and their health status, that cannot be due to factors like suggestibility or media persuasion. That is really only interpretable as a causal effect of the exposure. So in that setting, we know 100% that the exposures are tied to the health problems. Also beyond the, quote, symptoms, unquote, which are bad enough, there are the elevated rates of a good number of health problems, including heart disease, et cetera, certain cancers, et cetera, that are not things that people are just experiencing in their head or making up. So this pattern where people who are not themselves affected, disbelieve others, and sadly, because the medical community is often not well versed in these kinds of issues, there's some doctors that are wonderful about this and some that are not. And so doctors can unfortunately contribute to this. And we've heard from Gulf War veterans, and we're getting the same impression here, that some of the veterans told us that their biggest psychological wounds as a result of their service were not from any of the horrors that they experienced in war, but from the way they were dishonored and the way they were treated because of the illness that they experienced as a consequence of their honorable service on their return.
And as you have said, the residents, because they've been sick and have lost their health care and don't have regular health care and are struggling to pay their medical bills, some of their drug costs are in the thousands of dollars. What would it mean if everyone had health care there? We had national health care, and everyone, you'd be able to see not necessarily the names of people, but some of the symptoms if everyone had health care in that area and in this country. I mean, what would it mean to your studies, and would it make it easier to really find out what are the causes of some of these illnesses?
Yeah, I will say that the issue of national health care is an interesting one and a different one, but it comes with cons as well as pros. A good number of cons, and that's a subject for a different discussion. But clearly, these people were sickened as a consequence of events that they were not responsible for, and I do feel like this is the kind of setting where, our country should pull together and make sure that they have care for a set of injuries that they in no way bore responsibility for receiving, and where the payment should come from, polluter pays or whatever. I don't want to get involved in that because I really want the focus to be on our health study. But clearly these are individuals that are in need of access to health care.
I'm referring to, I've interviewed people who live near oil refineries, people who've lived near radioactive dump sites.
Mm-hmm.
And it seems that, one of the problems and issues is in order for them to get compensation, they have to point to the relationship of their illnesses, industrial or whatever, to that. And that's part of the problem. And also the surveys of where people become contaminated, where they've lived. Wouldn't that have some effect as far as looking at patterns of where people are getting sick and what diseases they're getting as a result of that relationship?
Absolutely. We have those kinds of things. Again, for the Gulf War, there was the so-called Camisea munitions depot demolition, where we demolished a munitions depot that had chemical warfare agents. And so, yes, there are data that people that were closer into that demolition or had a longer duration of stay near that demolition have higher rates of things like brain cancer, lung cancer, brain atrophy, et cetera. So those patterns of illness, in relation to exposure are important. I will say that another lesson, however, from the Gulf War is that your proximity to the exposure is only one index of how seriously you were exposed, because these major differences in detoxification processes that are genetically determined mean that one person with nominally the same exposure can have a radically different exposure experience than another one. And even unexpected cofactors, for example, with statin cholesterol-lowering medications, people who drink grapefruit juice, which impairs the detoxification of that particular, of certain of the statins, can lead the peak concentration of statins in the blood to be over 30-fold greater in some individuals. So that introduces a lot of variance, meaning that it's not a clean relationship between distance and exposure or distance and illness. And you can overcome that with a large enough sample size. You can overcome that variance. But it does mean that really more important than just looking at, is how, exactly, you were further out, but you're sicker than this other person that was closer in. Another way to look at things is the pattern of health effects that emanated as a consequence. Does that match the pattern that was seen with other mixed toxicant health exposures where we had much bigger populations to study? And so I think we should be learning to piggyback on the lessons that have been learned in other scenarios in order to enhance both the cost efficiency and and reduce the time to understanding of the impact of one agent. We should be, learning those lessons from those other exposure events and translating them, and that's what we're trying to do in our study.
And it sounds like your survey, your investigation, which you're going to be releasing in a couple of weeks, is important to the residents and workers in East Palestine. Do you think that there should be, and this is a political question, obviously, any settlement when the knowledge of the effect of these contaminants on the residents and workers is still really unknown?
I'm just going to say that my preference is to stay away from questions about things like settlements. I think that the authority of our work will be construed as greater if we try to stay away from the political and financial aspects. I think there are many other parties that you can go to who will be happy to opine on that issue.
So what do you intend to do when you release the study? What will happen to it then?
Well, let me just say, I think you must have learned from somebody else that we will be sharing some results with the participants locally, and that the NIHS has asked that we, before we do that, share results with certain of the stakeholders. But we will not be releasing the results publicly until later. We will be submitting the results for scientific publication. They will go through peer review, and that process takes an uncertain amount of time. And really, that is the point at which we can be talking to sort of a broader public about what our results are.
And other agencies which are regulatory and doing oversight, will they have access to your tests? EPA, the Department of Health, Education, and Welfare. I mean, there are many agencies involved. Are they going to be able to get your study? And
so prior to our communicating the results, shall we say, privately with the community, there are parties at who are working with these NIH East Palestine groups that are right now assembling the list of parties with whom they would request that we share the findings that we'll be sharing with the community. And that list has not been finalized yet, but it is even today there are emails circulating about what parties and offices should be on that list.
And you say you did studies of the Gulf War veterans. How long did those studies take, and are they still ongoing?
Yeah, so every year the veterans had to appeal to Congress for funding for the next year for research into Gulf War veterans' illnesses. And a couple of years ago, some of the most articulate veterans became themselves perhaps too ill to continue that effort. And so I'm very sad to say that that dedicated pot of money for Gulf War illness research went away. We are still doing several studies. We're doing a larger scale genetic study We're actually finishing one right now that is relevant to what we talked about, which is sort of what was your healthcare experience? Because I mentioned that a lot of times veterans reported to us that their healthcare providers dismissed and denied their problems, and that was really a huge source of anguish for many of the veterans. We also just are finishing up a study, very interesting, looking at alterations in the cell membranes of Gulf War veterans, and another one that looked at, quote, gene expression, which is two people can have the same genes that may code for, like, for example, a detoxification enzyme, but one of those will produce a lot of that enzyme and another person will produce very little. So exposures also affect the expression of genes. So your genes are not the only determinant of how well you will do. There are other biological factors that influence, and that also has produced really exciting results that we will be working soon to prepare for publication. And then we also have a treatment study underway in Gulf War veterans using coenzyme Q10, which is following up on a previous study we did that did show significant benefit to symptoms and objectively measured physical function. And we're going to be trying to do a follow-up analogous effort in East Palestine as well to see if we can mitigate symptoms and improve some outcomes with intervention that addresses some of these core mechanisms that are involved with many different chemical exposures.
What is the treatment for some of these chemical mixtures and the toxins? Are there treatments?
So that is a complicated question, and many of the treatments are ones that have historically been targeted to specific, symptoms or problems that arise. Things like if you have sinus problems, you can do nasal irrigation, or if you have this or that. But in Gulf War veterans, we found that, again, that the level of mitochondrial injury based on muscle biopsy in a study that we published last year correlated with the severity of illness, and a treatment that we had tried, coenzyme Q10, that supports mitochondrial energy production, significantly mitigated symptoms and improved objectively measured physical function. That has not yet, again, we're doing the replication study right now, and we will be hoping to reassess that in a very small pilot study in East Palestine as well. But I would say that it could not be stated that right now, our hope is that our work will show that, again, that there is this shared mixed toxic chemical exposure health profile with shared treatments that can then be borrowed from one setting to be reapplied and produce benefit in the other. But that has not yet been validated. That is what our studies are seeking to do.
Okay, well, I want to thank you very much, Dr. Golom. We've been talking to Dr. Golom, who is part of a project based at University of California in San Diego to investigate not just East Palestine, but other toxic contaminant dangers from the Gulf War veterans to the disaster in New York, 9/11, and the buildings that fell down, and now what's going on in East Palestine, and try to discover what is happening to people, their illnesses, their health symptoms, and what can be done about it. So thank you for joining us.
Thank you very much. I'd just like to say that if anyone from the affected area is listening, you can reach out to us at GRG for Golom Research Group -EP for East Palestine at ucsd.edu. That's GRG-EP at ucsd.edu. And I really want to thank you for the important job you're doing bringing attention to this issue.
Well, thank you very much, and we hope to help people and save lives so people can not suffer as they are suffering now. So thanks for joining us.
Thank you so much.